All right. Good morning. Hopefully we'll do it better again today. Hope everybody's having a great morning. It's sun shining. Looking out on the farm fields this morning. We've got a big giant turkey out in one of our fields. It was fun to watch him. Good morning. Hopefully we'll do it better again today. It was fun to watch him strutting around with about, I don't know, 9 hens and 4 jakes. So that's always a positive in the morning. Again, this is here's my issue. And as always, we're always looking for our audience to grow. So please subscribe to the channel. If you're enjoying the broadcasts, I know we've had some problems with our technology, but we continue to work on that. And I think we're getting a handle on it so we can enjoy spending some time together. And if you like the video, it's always important to like the video because it helps with the search engines, helps me get more exposure, helps the show get more exposure, which can only lead to better content and more people getting involved. And as always, I'm going to get on here and say good morning to everybody. And please, it would be nice to see some response. And get on that chat and shoot me a good morning back. And also, please comment on the videos. There's a lot of videos to watch. We have 5 or 6 full episodes that we produce once a week with more content and on specific topics like jobs and Social Security and the Second Amendment. So please take some time to enjoy those videos and like them and subscribe again, because we produce a feature video every week, and then we have the show every morning here at 9 a.m. And of course, during the show, if you're so inclined, go ahead and call in. That number is 715-352-0801. And we will get those things posted as times go on and we get more production work done before the show. Again, we're still looking at things related to COVID. It's a heavy portion of the show right now. And to be honest with you, very troubled by what I'm seeing in the news. And I just want to review some of the current statistics. If you go to the COVID page on the dhs.wisconsin.gov, and the link will be in the video after we're done here today, we'll update the descriptions with all the links of the varying pages we go to this morning. We currently have taken 18,819 tests. Now, what's important about that is in a few minutes here, we're going to listen to expert in pulmonology and flu, and he's going to share some information related to testing groups. And right now, if we who are appearing sick are being tested, and still we're only testing positive about in 7.6% of the cases. So for example, here in Wisconsin, we've tested just over 20,000 people, and only 1,550 of those people have tested positive. And of those 1,550 people, there's only 398, roughly 26%, who are actually in the hospital. And what I want to share with you is that that's around the state, and we have a map here that they have on that same site, that it's important to understand where the heaviest concentrations are. And the heaviest concentrations are in areas where we have a number of hospitals. I mean, just think about how many hospitals we have here in the Wausau area alone. And we're only 40,000 people, maybe 50,000 as you go out around the area. So, and encompass more geographic area. Now, both Ben Shapiro and the CDC and the president and Philip DeFranco are, pushing a message out there saying we could see 100,000 deaths from COVID-19. And I'm not really sure where that data is coming from in that model. And that's 100,000 deaths here in the United States. And they're also pushing the idea that we'll see that in a heavy portion of that in the next 2 weeks, the next 4 weeks. So let's just, based on the information I shared with you and the percentages I shared with you, let's just take a minute and let's think about what that looks like. So for us to hit 100,000 deaths, and if we're at right now a mortality rate of 1.5%, which is what's represented in the information from the Wisconsin Department of Health, we would have to do 7 million positive test results, which means we're going to need to do 93 million tests. The entire country hasn't done 93 million tests since October. I think it's important to remember that this has been going on since it started in China. And the testing in the United States, of course, didn't start until very late. But we still aren't seeing the kind of curve that would double, triple, quadruple, make it 100 times the number of tests we've done in the last 6 weeks. So when you hear Fauci and you hear talk show hosts say to you, well, we could see 100,000 tests, the CDC even acknowledges they're guessing. It's not like they have a definitive idea on how much impact this virus will have and how many people will get sick. And Fauci acknowledges that every time he gets in front of the camera. And you need to remember that they're guessing, okay? And the problem is that I have with all of this is that I don't think shutting down on a country level is appropriate for guessing. I think taking precautions is always good. We take precautions with relationship to the flu. Now, on that note, again, I'm going to keep harping this because it's just not being put out there. And I'm hoping that, this information will get to you and you will understand that there's more going on here than we know about. 54 million people in a year will get the flu. 54 million. Not 7 million, as we're projecting here with COVID. 54 million will be sick with the flu. 26 million will make medical visits. 730,000 will be hospitalized. 62,000 will die. And this happens every year. So while we're guessing with COVID, nobody seems to be so concerned about people getting the flu because I can tell you primarily of those 62,000 people that pass away each year from the flu, a majority of them are probably elderly and a majority of them probably have some kind of underlying issue. And they have to understand that they're communicating something to us that hasn't even reached levels of the flu. We've never taken this kind of dramatic and devastating action and really challenged the country, the people of this country, to be good with 50 people making decisions about shutting down every state. You really need to be concerned about a single governor making a decision to that level. And moreover, the governor was tweeting last night that he's waiting on the assembly in order to take action as a state to do something for the citizens that are being heavily impacted, which would be businesses, but primarily those people losing their jobs. And losing their jobs and then facing they may only get $100, $200 in unemployment, depending on what their income is, or if they have higher income, the maximum they're going to get is $370. I don't know about you, but $370 a week does not pay the bills. Moreover, neither the assembly or the governor have addressed how people are going to have health insurance. So if there really wants to be a discussion about a crisis, the governor and the assembly need to start talking about what's going to happen when this spike of people have lost their jobs, and as of yesterday they don't have health insurance anymore because it's the beginning of April and most companies didn't continue health insurance for people they laid off, and they went ahead and just let them dangle in the wind. And now we've got all of the unemployed people for the month of March, which will probably be one of our heaviest unemployment months, no health insurance. But nobody seems to care about that. And nobody seems to be taking any action. Another interesting fact is if you're following elections, and of course we have one coming on April 7th and another one on May 12th, but those elections aside, there's the regular election which started with the Iowa caucus, and on April 15th, all of those people like myself who are running for office are supposed to be out collecting signatures. And April 15th is a huge day. You would have events scheduled. You'd be going to see as large a group as possible to get people to start signing, because you don't want to be trying to get those signatures in the last week, which is the week before June 1st. All signatures required for every election now, for primaries held in August and to be on the ballot for November. All the nomination papers, all the signatures have to be complete by June 1st, I'm sorry. And nobody's talking about it. And I emailed the Wisconsin Elections Commission, and I got an email back that said nobody's doing anything with that right now because they're focused on April 7th. Well, you're unleashing every single candidate in the state of Wisconsin and around the country on April 15th to collect signatures, banging on doors, handing people clipboards, handing people pens, coughing on their hands, whatever that might be. And nobody seems to be too concerned about it. Are we actually going to say we needed to shut down the state, and one of the major events that's going to start on April 15th we're just going to ignore? And I can be pretty sure that most people are going to not want troves of volunteers running around the state trying to get signatures. I know for my part and for my campaign, we will not. And I'm being very cautious because I'm a type 2 diabetic, and I've asked the state what they're going to do for disabled people who are in risk categories that are much higher than, say, someone who doesn't have diabetes or doesn't have a pulmonary issue. And that would be important information for the state to put out. Now the governor's pointing at the assembly, and the assembly's pointing at the governor, and we're getting absolutely nothing done. We'll try towards the end of the show today to give Scott FITZGERALD a call, see if we can reach him. I have reached out to him and emailed him on several occasions with no response, but we'll keep trying to track him down and see where we get. So again, we have this situation where, the information's always one-sided. So please take some time, visit the links. Currently I have the cases reported by the CDC currently as of April 1st, because there's information out there saying that we have over 200,000 cases in the US. And on the CDC site, updated April 1st, which was yesterday, we only have 186,101 total cases across the United States. The total deaths are 3,603. So if we do some quick math here, let's take 3,603 divided by 186,101 equals, that's 1.9%, about a 2% mortality rate based on the number of cases. So we're still at about 2%, and it seems to continue to trend that way. But again, they talk about as we see more cases, And as we were to test more people, there very well could be people walking around the state that have it that have no clue. They don't talk about the fact that there are people who are probably immune to the disease, to the virus, and they may just be a carrier. And you look at the information provided by the state of Wisconsin, and that would be reflected in the fact that you've got 1,550 cases, only 398 of them are in the hospital. So over 1,200 people, I'm sorry, 1,100 people are at home or are not feeling very poorly. And the data that's missing from this chart is how many people have recovered so far. And if somebody is in that 1,550 and they're not in the hospital, are they homesick? Are they just at home? Has anybody checked up? They need to be adding that information to show people, what the average recovery time is. We don't see any of that information. So if somebody gets it today, are they going to be better in a week? Are they going to be better in 2 weeks? Are we just simply saying they can't be part of society for 2 weeks? Because we talk about this incubation period, saying once you get exposed to it, it takes anywhere from 2 to 14 days for it to show up. And then nobody's saying how long it takes to get better. They are saying that people who have underlying conditions succumb to the disease rather quickly, but there's still so much data that we're not getting. Okay, so, and as of yet, I think one more troubling thing, and I'm going to look it up here, is the cruise ship, the 2 cruise ships that are out on the ocean waiting for somewhere to go. I haven't heard that someone has allowed them to port. The governor of Florida is saying no. And if there are Americans on that cruise ship, then they better be being brought back to this country and taken care of. The governor does not have the right to keep people out of this country simply because they're on a ship and they're sick. And I'm reading an article here right now. The Coast Guard is telling the foreign flag cruise ships to be prepared to care for people with COVID-19 for an indefinite period of time at sea or to seek help from countries other than the U.S., citing a health care system that is being overwhelmed. The instructions are in a new safety bulletin that took effect this week along the southern Atlantic coast, including Florida, which is reporting more than 6,700 coronavirus cases as of Tuesday evening. Again, here's an article, 6,700 cases. Well, if we look at what we're reporting here in Wisconsin, 25% of those cases would be hospitalized, so 6,700 6,700 times 0.25 is 1,675 cases. And okay, so how far across Florida is that? How many hospitals are being overrun? See, it's really easy to just say we're overrun. One of our previous shows, we called Aspirus Hospital, and we reached a gentleman named Andy, and Andy was not willing to really talk about it on the show. He wanted to call me back, and he has yet to call me back. I've called Aspirus 2 or 3 times to try to get information from them as to how many cases do they have, how much in the way of supplies do they have supplies that they could donate to the hospitals down in Madison if Madison is having that kind of problem. But I'm not seeing that information in here that we're having a problem down in Madison and Milwaukee or Appleton or any of those other areas. And then why aren't we bringing these people, if we're having a problem, to other hospitals close by? I mean, you have to remember, Milwaukee, Madison is a huge area. It's not just pinpointed to 2 or 3 hospitals. You have hospitals in all of the suburbs. You have clinics in all of the suburbs. You have places that people can be taken to get treatment, and nobody's talking about that. They're all talking about the curve. Okay, fine. Then let's put the curve up on the Wisconsin Department of Health site that shows how many ICU beds we have in the state, how many are currently being used, and how many are available for COVID cases. Now, when they don't put that information up for 30 days, there's a reason for it. And they don't want us to know it because they only want us to know the information that creates the most fear. And I'm here saying, stop being afraid. Be cautious, be ready, take vitamins, get out in the sun, one of the strongest mechanisms, and I know a lot of other talk show hosts are talking about the same thing. Get outside, take a walk around, just take a walk around your house. Go sit out on the porch. Go be out in the sun. One of the biggest deficiencies people suffer from are vitamin D. And vitamin D is something people should have, and it helps them be healthier. It helps them think better, helps them think clearer. So we need the sun. The sun is important to how our bodies handle everything that goes on around us. Take vitamin C. Vitamin C is always a good opportunity to build up your immune system and fight things off and get better. My wife and I take a lot, if we start to feel we're ill, we start to take a lot of vitamin C. But again, if you're really feeling that poorly, you always need to go see your doctor, or at least contact your doctor and let them know what your symptoms are, and they can give you direction as to what you need to do, whether that's come into the clinic or to just sit tight and see if it gets worse tomorrow. And if it gets worse tomorrow, unless you have some sort of emergency, because there have been conversations about people who have been at home and then just start coughing up blood without much notice, if you will. I mean, and we don't know the facts, so we're getting whatever pieces that portion of the media wants to present to us. So we got to think about it a little bit. I don't think we just start coughing up blood like we're on some movie here. I mean, obviously they were feeling poorly, they were probably having a hard time breathing, and they were coughing, and they started coughing up blood. Well, of course, you know, if they've made you stay out of the hospital and you start coughing up blood, then you probably have to get in there as quickly as possible. So again, it just really depends on everything that's going on for you. And now, going back again to the statistics, if you look at the statistics for the cruise lines, if what the government of the country and the state governments is true and they want us to believe, then every person on a cruise ship should be sick. They were exposed to each other for at least 7 days, if not 14 days, before they were being quarantined. So you got to think about those dynamics. I mean, people like to put these group demonstrations together showing, okay, so here's a group of people, let's say it's 100,000 people, and now we're going to introduce this one person, and here's how fast it's going to spread. It didn't spread that fast. And if you think about a cruise ship, or if you've ever been on a cruise ship, I mean, people are shoulder to shoulder sometimes, they're in the pool, they're sweating, they're laying on lounge chairs and then getting up and somebody's coming and laying down on the lounge chair. The dynamic on a cruise ship and the opportunity for people to get exposed to the virus and become ill is greater than even the opportunity in, say, school. Now, not only that, they eat in open environments. So they have big buffets, and you've got this, you know, let's say 1,500 people on a cruise ship or more, and they're going to dinner and they're sitting at group tables and they're going up to the buffet, and maybe somebody takes something and then puts it back. I mean, it happens. I mean, we've all been at buffets. We see what people do. And that dynamic to me seems to be the best representation of how the virus spreads and how aggressive it is. You can't take the dynamic of New York City and say that's the same thing as what's happening in Milwaukee, or that's what's happening in Wausau, or that's what's happening in Black River Falls, because there isn't the density of population. Of course, LA, New York, Miami, all these places where you have millions of people condensed into a very small area, you're going to see a much larger impact on that group. But again, we are not getting data on how many hospital beds are still available. What are they doing? Are they concentrating it and then just trying to isolate these people in this small area so they don't take them somewhere else? Well, you're going to have to take them somewhere else. That's just the way it is. And you're going to have to isolate them, get them into the ICU, isolate them there, and take care of them. Don't be shoving them in corners, because there are plenty of hospitals around the area. There, in the state of Wisconsin alone, we're not seeing the numbers that would overwhelm our hospitals. And we need to be working together, if that really is the case, and have people who have the flu or the COVID-19 either be focused. The hospital needs to move everybody like they're doing in New York onto the ships that need surgery or don't have COVID, and get them out of that hospital, and then dedicate the hospital to treating those people. And they need to start rotating medical help and medical people, nurses, doctors from areas that don't see that kind of demand and could then go down and provide some additional support. They can bring their PPE with them. So, you know, there are lots of things that could be done that I don't think are really being brought to light and being planned for. We're all just saying, well, you know, Milwaukee's got 60 cases and we're overrun. I don't know how we're overrun. So I'm hoping that as we go forward, we're going to see better data on that. Now, on that note, what I'd like to do is I'd like to play you a podcast from an expert from outside the country who has worked with the Wuhan area, understands what's going on there, and also I have the video. But the nice thing about the podcast is there's an interpreter and he's talking, so it's sometimes easier to hear. So it's about 10 minutes long, and I'm going to play this for you, and hopefully you'll find it interesting and informative. Give me just a quick second, and I will find it. Let's go here.
I would like to tell everyone something about the coronavirus epidemic that we are allegedly having right now. First, I thought the hype was going to end again, but it's increased so much, we finally have to start taking a closer look. I worked as a doctor and conducted a health department. I had my own sentinel, my own system for monitoring flu diseases. And every year I observed how many people became sick in an area of 150,000 inhabitants. Every year, worldwide, we have new types of viruses because the viruses have to change themselves. If the same viruses came year after year, our immune systems would recognize them, so they would not be able to make us sick or to multiply, which is what they want. So they regularly have to change a bit, and that's why we have new variants of these viruses every year. There are about 100 different types of viruses that are changing constantly. Up to now, we really didn't care which viruses caused this flu or disease or however you want to call it. But there have been investigations for several years in Glasgow. There, they tried to use the available tests. That means they didn't examine all 100 types, just the ones they had tests for. So they looked at maybe 8 or 10 different viruses, and coronaviruses have always been part of them. These are the figures from Glasgow. Starting from 2005 to 2013, they checked which viruses occur among respiratory diseases, and these colored columns are the viruses. The green part refers to the coronavirus that was always part of the mix. The coronaviruses normally make up 7 to 15%, maybe 5 to 14%. It always fluctuates a bit. Hence, it's just normal that a big part of viruses are coronaviruses. So the following happens. In Wuhan, there is the biggest safety laboratory for viruses in all of China. So there are a lot of experts on the topic dealing with it all day long. Wuhan is a big city, 11 million inhabitants, big hospitals, big ICUs, always people being ventilated, people with pneumonia, hundreds of them. And they did tests with a few patients, less than 50, looked for viruses they had and examined their RNA in the lab, and they found a new type. This attracted their attention. When a virologist finds something like this, he puts it in a global database. And this database is accessible for scientists all over the world. In Berlin, for example. In Berlin, they checked and compared this new entry and tried to create a test to measure this new variant of coronavirus. Then Mr. Drosten submitted a protocol to the World Health Organization, and it got admitted really quickly. Usually, as a test is considered a product of medicine, it has to be validated. That means it has to be checked very precisely. What does this test actually say? What does it measure? The mentioned test is an in-house test developed in the Charité clinic, but because there weren't any validated tests and the great panic arose, it was decided to just use this test everywhere. And then Mr. Drosten provided the test. Of course, the virologist can't say if the virus is dangerous or not. He can only say, this one is different, or we have a test for this. But is the virus dangerous, Mr. Drosten? How is he supposed to know? He would need further epidemiological data based on observations of how sick the people are. How fast do they get healthy again? Are there less victims than before? That's why it's important to look at the data from previous years to compare them. To look at the mortality rates to see how many people died of the virus. So while looking for a specific virus, for example, the coronavirus, you can examine the total population. What you will find is that presumably around 8 or 10% of the population will have some kind of virus that makes them sick. But if you examine medical practices, do your tests there to determine who is sick, then of course you would find a lot more positive cases. And if you examine hospitals and take samples there, then you would find even more corona-infected people. That is to say, depending on which proportions of the population you examine, whether it is the whole population, patients in the waiting room, patients in a clinic, or when you examine very ill patients in the intensive care unit that are about to die, you will expectedly find these 7 to 15% coronaviruses every time you do a test. However, if they die of the coronavirus or of another virus while just having also corona, that can't be determined for sure. So when you look at the death rates in Italy, you want to know where the tests have been taken, where and how have these few available tests been used. If they were used in a hospital on serious or terminally ill cases, then obviously the corona death rates rise. It gives the appearance of being high because of the specific group that was examined. Mortality, disease-specific mortality, refers to the percentage of dead among the people infected with this disease. And concerning the seasonal acute respiratory disease, commonly known as the flu, there is a mortality of 0.1%, which is already the maximum. That means that 1 in 1,000 flu-infected inhabitants dies every winter. So now we will have to see whether this number increased because of coronavirus. The assumption for Germany is that there are 20,000 or 30,000 more deaths than without the flu. This is called excess mortality. So now we know that coronaviruses always make up 5 to 14% of all flu viruses, let's say 10%. Let us assume in the previous years we tested all seriously ill patients in the hospital on the coronavirus, which of course didn't happen. We would have expected to find 2,000 to 3,000 people dying of a flu each year that also had the coronavirus. And with their creation, they really impressed the Chinese government as well. The Chinese government made something really big out of it. Suddenly this was a very important politically, completely exceeding the virological frame. All of a sudden, face recognition was installed everywhere at the airports. Fever was being measured. The clinical thermometer controlled the traffic on the Chinese streets. And all of this was so significant that it led to international consequences. Politicians had to deal with it, had to take a stand. Then the virologists came into play again. The governments asked their own virologists, and they confirmed that this virus is a thing to worry about and proposed to develop tests to help measure the virus, like in China. Something was woven around this. A network of information and opinions has been developed in certain expert groups. And the politicians turned to these expert groups who initially started all this. and they really absorbed this network and moved within it. This led to politicians who now are just resting on these arguments while using these arguments to evaluate who has to be helped to determine safety measures of what has to be permitted. All these decisions have just been derived from these arguments, which means that now is going to be very hard for critics to say, stop, there is nothing going on. And this reminds me of this fairy tale about the king with no clothes. And just a small child was able to say, hey, he is naked. All the others on the courtyard surrounding the government and asking the government for advice because they can't know themselves, they all played along and joined the hype. And like this, politicians are being courted by many scientists. Scientists who want to be important in politics because they need money for their institutions. Scientists who just swim along in this mainstream and also want their part. We can help too because they want to earn money with it and become important. And what is missing at the moment is a rational way of looking at things. We should ask questions like, have you found out that the virus is dangerous? How was it before? Didn't we have the same thing last year? Is it even something new? That's missing. And the king is naked. All right, folks, I hope.
All right. So that same doctor is on a video on our site. I'm going to add it as a link if you come back to watch the video. Otherwise, just go on to the site. It's one of the first videos up. I'm probably going to move it to so it comes up right away when you approach our channel, and we'll see if we can get that gentleman on the phone. It would be nice to talk to him now that we're where we're at with the virus and see how his opinion has changed or if he's still holding the same thing or the same ideas. And it would be nice for him to go ahead and comment on how we're going to get to 100,000 deaths here in the United States, meaning we're going to have to do 93 million tests, or we're going to have 7 million people get the virus, and we're not even close to that. I mean, if we got to 1 million people who got the virus, it's not going to be the death rate that they're projecting, and I think that's irresponsible. Just being honest, I think that's irresponsible. But as always, we need to stay safe, and we need to continue to work with the information we have. But the objective of this show is to, provide a contrary view if need be, or be a supportive view. I'm supportive, as I am every year when the flu season comes. Washing your hands, covering your mouth, all those things. And that won't change because we come off of these restrictions. I mean, that we should be doing that all the time. And we should be staying home from work when we're sick. And we all know what happens. And we go to work because we don't want to use our PTO because nobody gives sick days anymore. So now we're using our holiday time to try to, be sick. And, maybe employers need to take a look at structuring things in a way that allows people to earn sick time throughout the year. And when they get sick, take that sick time and separate that from PTO. That might be just something they need to take a look at. I don't know. It's something I'm going to take a look at as I hire people again in years to come. So as we wrap things up here, let's make a quick call and see if Senator FITZGERALD's available to talk a little bit about what they're thinking they're going to do. No promises here, but we'll make a call and see where we get. Good morning. This is Michael OPELA. I'm a host of a show called Here's My Issue, and we're calling members of the Assembly based on the tweets the governor sent out last night. And I was curious if either your office or if Senator FITZGERALD's available to maybe address those comments.
Yeah, our communications director is working from home today, so I would encourage you to send him an email with that request.
Okay, and what's that email?
That would be Alec, A-L-E-C, dot Zimmerman, Z-I-M-M-E-R-M-A-N, at legis, L-E-G-I-S,
Mm-hmm.
dot Wisconsin, dot G-O-V.
Okay, Senator FITZGERALD's not available.
No, he is not in at the moment.
Are you guys back in session yet?
Not at the moment.
Do you have a plan as to when you would be in session again?
I'm going to refer you to our communications director regarding those inquiries, so.
Okay, I didn't think it was a secret, but okay.
It's not a secret, it's just we're in discussions right now, trying to figure out when that's going to actually happen.
All right, I will email Alec.
Sounds good, thank you.
Thank you. So, as you can see, people continue to be evasive who are supposed to be helping us. It should be very easy to know right now it's April 2nd when they're going to be back in session. They should have been in session in the middle of March, don't you think? So on that note, I thank you for joining me today. Continue to join me. Please subscribe. Please hit the like button because it helps get my videos out in front of people when they search on YouTube. And please share this video with all your friends. I mean, share it with anybody. I mean, just tell them, even if you're not much of a Facebook person or, any kind of Instagram or Twitter. And we are on Facebook. We are on Twitter. Watch the videos. All the links are in there. We have the links in the descriptions down below. And we really would just love to have you join us on a regular basis and get alerts. It's very nice when you're subscribed because you would not only get my alert if you're watching me from the information sent out on Facebook, but if you don't use Facebook, subscribe and turn the little bell on to all, and when we go live, you'll get a notification that we're live and you can join us. And again, please take down the phone number. The phone number to call us again is 715-352-0801, and that information's is also down in the description. And to be honest with you, over the years I never really knew how to gain all that information. There's a little show more button. If you click on show more, everything in that description comes open so that you can see it, because it wants to compress it when you start watching the video. So just hit the little show more button and it'll show you all of our links, the phone number, any other information. We're going to be putting more links on this video and other videos to the sites that we're talking about, like the cruise ship information, the state COVID location, and any other important links we might feel you important.